That's the lesson today. Every week I try to bring you a lesson from one of our case studies of our patient. And this one really is about sort of the state of the industry, where we are at in treating back pain, because things are changing. They're changing because they have to change. $86 billion, there's as much money spent on treating back pain than on treating cancer. And that is hard to believe because back pain tends to be a biomechanical problem, and we understand the biomechanics. Cancer is a little bit more difficult. Sometimes it's like chasing a ghost, where biomechanics are the same for everybody. So that the fact that we spend $86 billion is, shall we say, ridiculous. Our goal is to give you tools. Our goal is to give you tools that helps you make better healthcare decisions. Doctors are not obligated to report the results, which is why we spend $86 billion, because most of that money is not doing anything. It's not solving problems. Quite frankly, a lot of it is creating more problems. So my goal is to educate you and help you make better healthcare decisions. We have a 9-step process, and part of our 9-step process is education, which is what we're doing today. We have tips. We did a tip yesterday. It was on neurodynamic flossing, gliding on the nerves. Tomorrow we're going to do an exercise. We were scheduled to do that today, but something came up and I wanted to do this because I thought this was a little bit more important. So, case study 233, 26-year-old female, so young. Back pain and sciatica for 3 years and confused, and had gone through the normal regimen. If you have back pain, this is kind of the path. And this path is the path that costs a lot of money. She originally started with some pain medication. Recently, the American College of Physicians just put out some clinical guidelines, and their goal is to prescribe less narcotics. Why? Because people die at an alarming rate from overdosing on narcotics. This is the state of the industry. That's what this is about today. This is about the state of the industry. She started with pain meds, went to a PT, didn't get any better. Then went to Tylenol, wasn't helping. Saw a pain specialist. She got injections into her spine. We've had a segment on injections and how they're only 50% of the time effective. And even then, the long-term effect is not very good. So it didn't work. She ended up in the office of the neurosurgeon and she had stenosis. So typically, next step is surgery. This is the typical path. This is the path that costs so much money because patients bounce around like a ping pong ball and then end up here. Without any solutions before that, she wound up in the office of the neurosurgeon, wanted to do surgery. She didn't want to have it. She came to see us. But the point, $86 billion spent. $46 billion are billed to insurance companies every year for surgeries. And the surgeries at best are 40% effective. So a lot of the therapies that are currently being done are not effective. She came in to see us. There are 5 main trends. And over the next 10 days, we're going to talk about the trends. And the reason they established new guidelines is because of the trend of the narcotics. There's also a trend with the surgery. So we're going to talk about these trends, not today, this is the beginning. But we're going to talk about the 5 major trends. So when she came in to see us, we did an evaluation and we identified through our process that she had a bulging disc stenosis, and that was compromising her spinal nerve, which was then causing her the sciatica. She had 2 of the 5 reasons, but she was 26 years old. She was young. You don't want to have surgery on your spine when you're 26 because the consequences sometimes are devastating. It's a slippery slope, and sometimes it just gets worse. So she had the bulging disc compromising the nerve. She had the stenosis, which was the narrowing in and around the nerve, causing the pinching of the nerve as the nerve exits directly through the foramen. So she had those things. Surgeon wanted to open it up, free up the space. Typically the goal is laminectomy at that point in time. Okay, with a Stenosis goal is to open it up, pull the lamina off there. So when she came in, her back pain in her sciatica was a 10. Her Oswestry Disability Index was a 46. Oswestry Disability Index is your level of disability as a result of your back pain. How much effect does it have on your life? So potentially, there's 5 categories. 0 is where you want to be. 100 is bedbound. 80 to 100. So these 5 different categories. She was in the severe disability category, and those patients typically end up having surgery. And again, the outcomes of surgery are not very good. This is also about the evolution of back pain. Back pain treatment is evolving, and hopefully, so she came in, she was a 46, back pain was a 10. She had 23 treatments. We have a treatment where we take pressure off the disc, and then we get healing of the muscles. We take pressure off the disc, we activate the muscles, and then we get healing in the disc as well. So at the end of it, her back pain was a 1, her sciatica was a 1, and her Oswestry Disability Index was a 14. Our goal is to get your pain down as close to a 0 as possible, but also our goal is to get your Oswestry Disability Index down below a 20. So we had gotten her into what we call the safe zone. She was feeling better, able to live her life, able to do all the things she wanted to do. And again, before that, she was stuck, and she was sliding down the slippery slope into ultimately what was going to be a surgery, laminectomy, and potentially even a fusion. So came in, got her treatment. We followed up with her 2.5 years later. Back pain at a 0, sciatica was 0, Oswestry Disability Index was a 0. Even after she left, she got better. Gave her exercises, she continued to get better. So back pain is evolving. Back pain treatment is evolving. This is the evolution. This is the next step. Okay, $86 billion spent on surgeries and procedures that don't work. This is what you need to know. There's a little bit of chaos, and right now there's change, and hopefully change for the right direction, but we offer opportunities to get you better. We take you from pain and suffering to really being able to do what you love to do for a lifetime, and there are 9 steps along this pathway. That's what we do. We solve the problem in the disc. We do what nobody else can do. We solve the problem in the disc. If you have back pain and you're not getting better, you need to come see us. We want you to share this information with your friends and family. Okay? Share it with your friends and family. Anybody that may have a problem that needs our help, share it with them. But also like our Facebook page and subscribe to our YouTube channel. There's a lot of money being spent on procedures that don't work. That is the state of the industry. We have something new, we have something different. It is the evolution. Our goal is to solve your problems without any medicine or any surgery, period. We're going to talk about some exercises tomorrow, and then next week we're going to go back to our normal routine. We're going to do the tips, we're going to do stretches, we're going to do exercises. We'll talk a little bit more about the food. You guys like the chocolate, so dark chocolate, just remember, dark chocolate's anti-inflammatory. That's it. I'm out. Today's Thursday. We'll see you tomorrow, Friday. Have a good night. Be safe.